All right, today's session is a lower limb focus strengthening session where we're using balance, resistance and strengthening based exercises here with Rob. We started him off in a seated position with the resistance band, just getting the hips warm and the knees warm, just doing some seated hip abductions where we're resisting out against the band to use our hip and external rotator muscles. From here, we get him into weight bearing where we're standing, and we like to use a rod or a broomstick to start with, and then we turn this into resistance. We're just doing it on the spot just to get balance and the calves and the hip flexors working. We then turn this into a lateral movement where we're holding our core and our body upright and then using the hip muscles again to resist against the band and push out. Here it's important to work both sides, your left leg or the right leg, whichever one is a stance leg, standing still, you'll still feel those hip and glute muscles nice and engaged during the whole time. We then move into hip extension, which is the band still around the ankle and we're extending the hip, which means kicking backwards or a donkey kick or a kick backwards. We like to use the wall for this one so we can change the angle nice and easy, where we're leaning slightly forward and we're kicking backwards against the resistance of the band. From here we move into a hinge mechanism, which is where the feet are planted nice and still and we're sticking the bum out to hinge forward at the hips and keep our lower lumbar spine nice and straight here. This is not a squat where the knees are bending, it's a hip hinge. From here we get the step going and we're primarily using our forefoot here to step up onto the box and step back down. So we're using our ankle and calf muscles primarily to push through and lift our body weight onto a step, which challenges our strength and balance of these muscles. From here we use the calf raise or the heel raise exercise. We do this on the step box again, holding onto the wall, nice and easy balance and just going up into the tiptoes. You can aim to bring the heels below the level of the step, but here with Rob, we decided to keep him at the level. Progressing from this, we use a cushion or an unstable surface on the box. It is quite challenging. It does make you focus and use the receptors more on the foot to ensure you re-stabilizing your balance. From here, we go back to another weight bearing exercise and practice the squat or the sit to stand. With Rob, we're recovering from some knee troubles and we're slowly building up in weight from here. So to get into the squat, we like to start him just from a chair to use those muscles to familiarize him with the movement. From here, we added the band around his knees and asking him to sit to stand or squat from here. The difference here is that the band's trying to pull you in and you have to engage additional hip extensor and hip abductor and quad muscles to push this band apart as you stand up to weight bear. From here, we added a ball or a medicine ball or a weighted ball, and this is at his chest where we decide to have it slightly forward so you can use it as a lever or a momentum as he's going to stand up from that chair. From here you can see he's getting nice and activated through these muscles where he's no longer struggling to get up out of the chair. From here we just added in a little upper body and balance type of movement where we just did some medicine ball slams before we moved into a front squat where we use the barbell across his shoulders and he holds this with his hands and we're doing a front squat. As we progressed towards the end of the session, we added some complexities, which is a single leg step up from a greater height. We use a balance for the wall, push through the legs, use the hip and the lower quad muscles to push up and stand upright. Then we go into a hip hinge or a deadlift or a suitcase lift. It's a similar mechanism where I've asked him to keep his bottom against the wall and then hinge through the hips. This would be better in a side video position, but from here you can see his hips are attached to the wall and he's leaning forward to put the weights onto the bench and then stand nice and upright. And they started with 4 kilos each side before we progressed up here to 8 kilo kettlebells each side. And each time he's just going down, picks the weight back up and then stands nice and upright. You'll notice we're using the bench and then the kettlebells add additional height. And the reason is for this because I don't want him going so far down just yet. We're progressing to that. So in another session, we would move that bench away and use a step. So then that surface or the height of it is much more reduced and it's easier for him to move. Thanks for watching. Until next time.